क्या अभी स्टार्ट होगा? हम्म? तो इसको मैं डाउन कर सकता हूँ, नीचे कर सकता हूँ क्या इसको?
हाँ
लाइव रहूंगा ना?
हाँ लाइव शो कर रहा है।
स्टार्ट कर दूँ? ठीक है। गुड इवनिंग। मेरा नाम डॉक्टर मनीष गुप्ता है। आई एम अ सीनियर कंसल्टेंट इन जेपी हॉस्पिटल. Today I will discuss about something about epilepsy. I will not go into a very deep. Only thing that you can understand, all of you can understand. So I'll start with general epilepsy. Okay, what it is, what are the symptoms, and then how to diagnose this epilepsy. Like if in front of you any of the patient is having epilepsy, patient having some symptoms or some clinical complaints, so that you can diagnose whether he is having the patient is having epilepsy or not. And then followed by different causes of epilepsy in different ages, then followed by what will be the treatment, and epilepsy in pregnancy, then epilepsy in adults and as well as pediatric patients. And in the later part I will touch about the COVID part also, because there is apprehension in most of the patients who are epileptic that whether if they get COVID and other things, whether the epilepsy will occur or not, or if the person who is not having an epilepsy but if he get the COVID, whether he will get an epilepsy or not. And later on, some myths and facts. Okay, so I'll start with the epilepsy, what it has actually, why this happens actually. So it's you have to understand for that that epilepsy is actually it's an abnormal activity. If you see that our brain is actually an electrical circuit. It's a closed electrical circuit, and the information is going from one point to another point. Like if you're doing any activity and if you are like thinking, seeing something, then all of the information, everything is going through electrical activity, and it's you're memorizing, you're doing some motor activity also. Like if you're just wiggling your finger, then also the brain is active at that point, at that area. So what happens is when there is an abnormal activity which is without the purpose, like you are not doing from yourself, which causes a high electrical surge in the brain, and that causes epilepsy. And in this epilepsy, patient can have various symptoms. Actually, a patient can have loss of consciousness. There will be an abnormal body movements. But sometimes patient, like most of the cases which you must have seen or in your mind, the epilepsy is like somebody is having jerking movements in the upper limb and lower limb, and he's getting unconscious, closing of mouth, and some eye deviation, head deviation to other side. But some are having different what to say, clinical signs and features. So uh, so these clinical signs and features, it depends on the person to person, as well as it depends on the part of the brain which is involved actually. So it depends on the part of the brain. Like if it is the part of the brain which is actually regulating your hand movements or your face movement, then the movement will be you will see in that area. But sometimes you may not see any movement, and there will be a variety of different symptoms which you should consider that yes, patient is suffering from epilepsy. And what are these things are, like sometimes patient can have only just a confusion for few minutes, maybe few hours. You must have seen child having staring spells for few seconds, and then he's totally normal. Some may cause loss of consciousness, and some can have behavioral changes in the form like fear anxiety, and uh, fear, anxiety, abnormal behavior, aggressive behavior. These and but this remains for a short period of time. Sometimes patient can have some sensitive symptoms in the hands, like patient feels some tingling sensation that will go from one place to another place. So all these symptoms could be a epilepsy symptom. Now, what are the types of epilepsy? You must have been heard about primary epilepsy and secondary epilepsy. So I'll not go too in the deep, but just I just want to show that primary epilepsy is such thing that in which if in which if there is no when there is no what to say there is no cause like in investigation. If we do an MRI, then MRI brain will be normal, and it's quite benign, the epilepsy. So the primary epilepsy, the most common epilepsy, is mainly be seen in child and adult, not adult, we can say um, 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 1 minute. Okay, so the primary most common is absence, and the second one is juvenile migraine epilepsy. These are very common, which we used to see, and the other secondary is basically anything which is because there is some cause which causing the seizure. Understood? So now the other part of the epilepsy types of which we can differentiate is like simple, complex, and generalized. Where simple is the difference between simple, complex only is that the patient will lose his consciousness or loss of awareness of the surroundings in complex and generalized seizures, but not in the simple seizure. Simple seizure can be what to say, just a sensory, just a motor, but in this the patient is conscious and he is aware of the condition which he is having. And the complex part is actually in which the patient will have an aura, like some part of aura. Aura is just preceded before the onset of any seizure, and aura can be sensory, motor, auditory. There are a lot of things are there. And then when this complex become generalized, like it start from one point and then it's going to whole of the body, then it's become generalized. So complex can be generalized, which we call complex secondary generalization, and generalized seizures also there. And the third part which we should know is status. Status epilepticus is a condition in which a patient is getting throwing seizures very frequently, more than 5 minutes, the definition. So now, what are the what are the causes of seizure? Like which causes seizure in a patient? It depends on the. I can say that age-wise, the most predominant part is infection, either a child or adult or a geriatric patient. Okay. Now, like in newborn child, patient can have a seizure because of pain malformation, lack of oxygen due to birth, that suffered of hypoxia, then can be a hypoglycemia, change in electrolytes, inborn error of metabolism, infection, as I already told you, and sometimes those child newborn which mother was taking some medication, and because of that, child had this seizure. And now then the kids, the toddlers part, like most common is febrile seizures, as you know. Then some are infections, and rarely tumors also. Now we come to adults. Like we have seen a lot of patients, mainly in this age group. The most common is infection, and then an infection. The what we have noted mainly in the northern India is that neurocystic psychosis, usually the most common cause of the focal seizures or the symptomatic seizures, secondary seizures. Then TB is one another, other infections. Then some genetic factor, progressive brain disease, which is very rare, and trauma, as you know. And in old ages, metabolic is most common, like hyponatremia, hypokalemia, hypercalcemia. That can cause seizures, then stroke, Alzheimer's, and some trauma part. Now, um, now, after this, after the causes, we should know how to diagnose the seizure, the epilepsy, what type of epilepsy it is. For that, we need a detailed history, along with family history that maybe some of the family members are having the seizures, which may indicate that patient is having a primary generalized epilepsy, some primary epilepsy. So, what type of seizures episode the patient had, what event the patient had during the event, was a focal side or generalized, whether the patient is having any aura or not, and for how, what was the duration of the episode, followed by whether the patient is aware or not, to differentiate between simple and complex. And then whether the patient had any injury during that episode, tongue bite, urinary incontinence, and patient had what was the feeling after the recovery, before the recovery. That will help. This will help in diagnosing, okay, whether it's a primary, secondary, which I have already discussed about the types of epilepsy, and the other investigation like blood investigation, that is very important. For like old age patient, I already told hypokalemia, hyponatremia, then EEG to know the electrical part, then MRI, CT, PET scan and SPECT scan. We used to do in those patients who are very refractory to the epilepsy, refractory to medications, and epilepsy is still on even on 4 or 5 medication. In that case, we have to do this PET scan, SPECT scan to know if any focal lesion is there, so that we can go for epilepsy surgeries. Now, the important part of is trigger that you should know. This is very important thing. If you reduce the triggers, then the frequency of the seizures and the events may decrease. Like sleep deprivation. Normally, these triggers are more important for the primary generalized seizure, like juvenile micro epilepsy. So if sleep deprivation is very important, then fever, pressure of bright light, alcohol, stress associated. Sometimes it is associated with menstrual cycles. Then if patient is not eating well, low blood sugar, hypoglycemia, specific food, and some uncertain medication also, patient can get seizures. And the seizures as such is, there is no as such at present there is no data in India, but on an average we can say that in India around every 10 out of 1,000 people suffers from epilepsy, and 1 in 1,000 children suffer from epilepsy, you can say. So, if a patient in front of you is having a seizure, or at the first time somebody is having, what you should do, the first thing that you should do, that you should remain there with the person till the time he is awake or alert after the seizure episode. What you can do is just to check if a patient is getting the seizure, you just check the medical ID, whether he is having a phone number of a doctor or the family, or whether he was on a medication or not, and the time of seizure, how long this was there. Then you should avoid, or you just remove in the vicinity of the patient any dangerous thing or any pointed thing, just to make him safe, but so that he should not harm himself because of the act of the seizure. And the third is, if if a seizure is ongoing, it's better that you should do not restrain the patient, but make him turn to one side, and till the time he is not awake, just to keep the airway clean, lose the tight clothes if it is there, and put something under the head, soft, so that he should not get any injury. All these things is very important when an event is uh, coming. Now, what you should not do during the seizure is, like we have seen sometimes, mainly that some people is putting something object in the mouth, or just putting their finger just to destroy the tongue, and pouring water, pills, and food something. Do not try this. Do not, and do not hold the patient. And if the seizure remains more than 5 minutes, if it is very vigorous and patient is unconscious, or is not coming out of the unconsciousness, then yes, you immediately call the hospital and consult the neurologist. That is very important. The next thing that you should do is, uh, now after this, like first aid, like what you should not do. Then the other thing that is important, like after going to the hospital, it's better that whatever you have seen, the seizures or whatever you have seen, you should tell everything in each and every detail to the neurologist or the physician whosoever attending the patient, along with everything what has happened, so that a proper diagnosis can be made. Now, what is the now if we come to the therapeutic part, now diagnosis is there, we know what investigation we have to do and all what the symptoms are. Now, therapeutic approach for the epilepsy. Now, it's slightly different between the adults and the pediatric. So, after the stabilization, examination, and history, what you should do is just to have a history of other comorbidities also, like patient whether patient is diabetes, whether the patient had any trauma before the event, or whether the patient had any headache before the event, any cardiac condition, any movement disorder, or any abnormal, any medication that he has taken, and the stress part, the psychological part, investigation history is also very important, because we have to rule out other things, like sometimes hypoglycemia can cause the symptoms. Sometimes patient can have a headache followed by we have to rule out whether some structural or brain tumors or something has happened which has causes the seizure. Trauma also is very important, because like extradural hemorrhage and subdural hemorrhage, sometimes initially patient will not throw any seizure, but after some point of time patient can throw the seizures. And then cardiac event and movement disorders, other things. So these are the mimickers that we should know. So that history and examination will make the diagnosis. Now the management part, if it is a first seizure and it is provoked or unprovoked, it depends on the depending on that, we can have the risk of recurrence of the seizures also. So uh, so um, so what things that we should know in adults epilepsy is whether it was unprovoked or provoked. If it is unprovoked, or the first seizure, then yes, we have to evaluate with the EEG, MRI, and other blood investigation. And if there is a history of fever, then yes, we should do a lumbar also. And we should start the AD. We are very sure that it was a seizure, and we should start the antiepileptic as early as possible, because that will cause reduce the risk of seizure recurrence over the past for the subsequent 2 years. So that is very important. Now, in pediatric, it's totally different. Like, because in unprovoked, if it is unprovoked seizure in pediatric, then there is less chance of having another recurrence or further recurrence. But yes, the investigation we should do, like EEG imaging, and we should differentiate some pediatric epilepsy like accent seizures, juvenile micronephropathy, which is very important. So we have to take a good history for that. And adherence of the medication is very important in these children also, so that at later stage patient can be seizure free as well as the medication free. Now, signs and symptoms of seizures in children is slightly different from the adults. Patient can have if undetected, the patient can have memory problem, intellect problem, learning problem. The movements will be like cycling movements of the legs and hands. They may have crying which is uncontrolled. Sometimes just involuntary lifting of arms and legs, eye twitching, lip twitchings, some patient just having recurrent vomitings, and sometimes the patient means in the school academic performance can be low, just and teacher will say that he is not attentive. So you should know whether child is suffering from acute epilepsy or not, and you should consult the neurologist if all these things are there. Now, epilepsy with pregnancy is also important. 90% what we have seen that the delivery remains normal. So before you planning for any pregnancy, planning for any issue, it's better to consult with the neurologist, so that accordingly we can start the medication. Now there are a lot of medications, AADs are which is safe in epilepsy, so that we can start. Um, Now, treatment is depends. First is medication. Most of the patient improve with the medication, but some patient may require, which are refractory to medication, may require surgery, and there are some other therapies like vagus nerve stimulation, ketogenic diet, and deep brain stimulation. And medication depending upon the types of epilepsy, um, um, like whether it's a complex or a simple or generalized, we can titrate the medication. Normally, the dose of the medication, the duration of the medication, if the patient is seizure free, is around 3 years to 5 years, and then after that we can taper off and stop the medication. But still, there is a 25% chance that patient can have a recurrence depending on the type of epilepsy that he has. Then the surgery. Surgery is mainly for those who are very refractory to multiple seizure, and so for that we have a different evaluating symptoms system that I already told about PAT and SPECT. Other than that, so this is done. Surgery is done in on those cases which have a very small, well-defined area, which is a seizure which is actually perpetuating the seizure. And these areas get operated, and we have to very sure that it's not the area which is causing seizure. If it is not interfere with the vital function, which is very important, like speech, language, and motor. So we have to balance between the two, whether the overall life of the patient is good or not, and depending on that, we have to decide for the surgery. And the other thing, vagus nerve stimulation that helps in reducing the seizures, and then ketogenic diet and deep brain stimulation is a new thing. After that, there is one entity which we call status epilepticus. The definition of status epilepticus is this: that if a seizure persists for more than 5 minutes, or patient is having frequent seizure and between patient is not conscious, then yes, he is in the patient is in status epilepticus, and there is a different management for that, and it's a very dangerous condition. So if a patient is getting more than 5 minutes, the bottom line is if patient is getting more than 5 minutes of seizure, it's better that you should go immediately or rush to the hospital for the immediate treatment. Do not delay the treatment. Epilepsy surgery, as I have already told, we discussed about this along with the medical management. Follow-up is very important. What we have seen that those patients who have actually a case of epilepsy, they get withdrawal seizures mainly because they are not taking appropriate treatment, not taking medication on time, and sometimes there is change in the level of the drug also. So sometimes we do some investigation like serum alcoholic acid and other things, just serum level for the anti-epileptic which we are giving to know whether they are on optimal medication or not, and accordingly we have to maintain the therapy. There are some myths that that epilepsy cannot be controlled. It is contagious. Sometimes patient can swallow their tongue. You should restrain the patient who is having seizures. Epilepsy is very rare. These are all myths. It's not like that. It's not contagious. Most of the patients with epilepsy do well on medication. Only little, very few patients require surgery, which is also to a great extent is successful. And if a patient is having a status, then yes, it is life. It is very dangerous to the life also. So now some part there is a because now as we know this pandemic is going on and COVID-19, so there are a lot of questions that whether the epilepsy patient or whether this COVID-19 can cause epilepsy or not. So until now there is no correlation between the epilepsy and the COVID-19. But yes, if a patient is getting seizure, then if a patient is in a seizure, known case of seizure and is getting fever, then yes, because of the fever, patient can have a prolonged seizure. Now, COVID-19, very few patients we have now seen neurological symptoms in the form of patient can have encephalitis, patient can have a stroke also in COVID-19, but these are rare causes. That if it is involving the brain, then yes, there are chances of seizures. But till now, we have not seen any of the cases in which patient is COVID-19 and getting a seizure. So, as You already know all these things that how to protect yourself from this COVID. So it's only that you should have a good diet, you should hydrate yourself, do exercise, reduce stress, don't smoke and don't take alcohol, stay connected, follow the social norms, wear mask and sanitize regularly. If you do all these things, I don't think that you will get this corona. um, uh, you may you may have some questions that is important in epilepsy, like what should be the follow-up, how to do a follow-up, if I am having a COVID-19, what I should do. So these things you can ask me on my Facebook page anytime. And what I say is, now I will end up my this session with only brief points. Is that epilepsy is curable, and most of the patient can be cured with medications. The only thing that we need is a proper history so that we can manage. Uh, and there should be, from the patient side, there should be adherence to the medication. That is very important. And the last and not least is that you should have a proper follow-up for the epilepsy, for the treatment of epilepsy, so that you should not get further seizures. And with this, I will end up my session. And I only will say this, that with epilepsy, we can cure if we just reduce the triggers and take medication properly. Thank you.